Hey everyone, it's Alexandra Moore here with MDPen. Today I'm talking about sun damage, how to identify it, how we can treat it, and also some skincare recommendations when discussing sun damage. Let's go ahead and jump right into it. We know that when we're born, we are born with consistent skin, clear skin, no lines, no wrinkles, smooth, unmarked, and then over the years, as we experience sun damage, this obviously changes where blotches, wrinkles, and things like that do start to show. There's a quote that I always like to go by. I worked for an amazing dermatologist in Orlando, and one thing he used to say to patients was, tan skin is damaged skin. So that's what I'll say for you guys. While people do like having a tan, you really need to think of your complexion and how you were born as a baby, and that is the skin that you are meant to have. So even though a tan might look really nice, it might look healthy, a tan is a form of sun damage. We also know the obvious, and that is a sunburn is a form of sun damage. Sunburns can be painful, sunburns can itch, sunburns can blister. If you have a fever of 101 degrees or more with a sunburn, you definitely need to contact and go see a doctor for sure. Now, sunburns that happen before the age of 18 are especially worrisome because these can affect us even more later during life. People that get intermittent sunburns are even more at risk. So if you lived up north and took those beach vacations 3 times a year and we're getting a sunburn every time, you're actually even more at risk than someone who is regularly frequenting the beach in many situations. So I'd like to put that out there with a sunburn. We also know sunburns are physically warm to the touch as well. So that damage done before the age of 18 is essential. It does come up later in life. I'll also quickly address tanning beds as a major form of sun damage. There has been scientific research proven that one time in a tanning bed increases your risk of melanoma by 70%. And in most cases, that's using a tanning bed once before age 18. So pretty worrisome there, not trying to scare you guys. Another way that we know to spot sun damage in the medical field are going to be precancerous skin lesions. And of course, if you're an esthetician like myself, you cannot diagnose your patient, but you can definitely look at the skin and learn how to identify in your head, okay, this place is red, it's scaly, it's flaking. My client is telling me that it comes and goes. So in that case, it's likely an actinic keratosis or precancer. We do not treat over those. You want to encourage your client to see a dermatologist or physician to get that treated. About 10% of these have the risk of turning into skin cancer. I would argue it's possibly more. They tend to go in the route of squamous cell carcinoma, so that is an actinic keratosis. There's also actinic helitus, which is a precancerous lesion that can occur on the lips, and again, this is going to be rough, cracking. It's usually identified on the bottom lip as almost like a white linear line. So a lot of times dermatologists will have the client kind of pout their lip down and you can actually see in there. So that's why we do pay attention to lips. Good things in dermatology never go away on their own. So if something is recurrent and not healing, it's always a sign that it needs to be looked at. Going along with that, I'll quickly touch on atypical moles, which again, we do not identify as estheticians. However, you do not want to treat over a mole, especially when microneedling anyway, but definitely not something that's atypical. We know those A, B, C, D, E's and how to identify. So something that's been darker, something that's been changing, something that's been bleeding, something that has an irregular border, different texture. Atypical moles are a form of sun damage, and these are the type of moles that can progress to melanoma. So it is very important to get those annual skin checks, and again, it is a form of sun damage, and this can appear as a new mole or changes in a pre-existing mole. Next, we have age spots, which of course we know are sun damage, and this is also known as dyschromia. This can appear as a liver spot, a dark spot. Some people will say, oh, it's my cute little freckles, which that's fine, but it's sun damage. So we know how to identify that. Lentigos or solar lentiginous would be another word. Next, we actually have rosacea. So you can actually harm the blood vessels in your skin from the sun, and that can be a certain component to rosacea. Basically, it's causing the fluid to leak out, whereas it may start as flushing and blushing that comes and goes. However, sun damage can definitely affect rosacea. Next, I'll go into things that are a little bit more cosmetic. Wrinkles. Those are a sign of sun damage. Primarily dealing with the face, we have the 11 lines, the forehead, the crow's feet, and other existing areas, laugh lines. These are all just signs that time was spent in the sun, fun times. Another thing we have is poikiloderma of Savat, which usually appears in the form of reddish brown blotches, kind of mottled skin, typically along the anterior neck, maybe going down to the chest. That's going to be poikiloderma. It's a pigmentation disorder. It is a form of sun damage. It is something we can treat, which I'll kind of go into next. I've heard different arguments. I worked for a dermatologist that oftentimes would ask if the client regularly sprayed perfume or cologne in those areas. And while it is sun damage, I think there's a good point to that it probably intensifies it even more with the sun picking up on those chemicals in the cologne, maybe aftershave or perfume. So maybe encourage your client or patient, if they're going to wear something like that, don't put it on your neck, don't put it on your sun exposed areas. And that's poikiloderma. So now I'll kind of go into treatment for these conditions. With microneedling, we know that we can definitely treat those fine lines and wrinkles, loss of collagen. You can treat over poikiloderma. This will help kind of give an even distribution. So although you may not be able to change the color or pigment that is actually there, you can change the skin around it. Again, if you see something worrisome, that looks like it could be an atypical mole, a precancerous lesion, some of the other things that we talked about, you do want to have that person checked medically prior to treating them, and you do want to treat around those areas. So you definitely want to know how to identify sun damage when you are treating. There's a wide variety of aesthetic services. Touching on the rosacea a bit, we know that there's lasers that can definitely help with this. In some cases, chemical peels. In some cases, when the precancers are there, a doctor may decide more towards PDT and Levulon. Let them do that first, get it treated, then go into your microneedling. But hopefully that helps you guys identify sun damage. I did pull some of my favorite MDPen products when talking about sun damage. Hopefully you guys aren't getting sunburns, but if you know someone who does have one and you have our human-derived growth factor, this is so soothing. It's amazing. You guys know after microneedling, when you put this on, it may tingle for a minute, but then it gives a really nice sense of relief. Same goes for sunburns. Of course, this is our professional size, but you would have that smaller retail size. Definitely have your clients use it for those sunburns or any type of irritation or trauma to the skin. I do love this product. Of course, we have MDPen's broad spectrum sunscreen, full of antioxidants. So you've got your environmental protection against free radicals, and you also have UVA and UVB protection. So sun damage, gotta wear sunscreen. Next, I did pull our Revita Peptide. This product is amazing for the face. It's also great for the neck. It has this synthiacin ingredient and some growth factors. Very soothing. So definitely for the neck, especially if you've treated someone, like I said, for that poikiloderma and they're gonna apply it in upward strokes. Again, touching on antioxidants, our CNE brightening. It is a really lovely antioxidant product, so I do hope you will try it, our CNE. And of course, we have good old reliable pure hyaluronic acid, definitely plumping those fine lines and wrinkles, which, as we said, are a form of sun damage. So we know microneedling can help break up pigment. It is not going to be your go-to treatment if someone's entire issue is based around chronic hyperpigmentation of their whole face. Microneedling can help break up pigment. When I am needling for pigmentation concerns, I do like to use our Tighten and Lift Serum as my glide. It does have that little bit of lactic acid. You're going to want to pull from another product line, either some type of kojic acid, hydroquinone, lightening product, whatever your physician is comfortable with writing to use as home care use to let that absorb into the skin. Another thing I'll touch on is that all of our MDPen products, we do have a small SKU, but they're all going to be great for treating sun damage. I definitely could have pulled our cellular renewal as well. And another thing that you want to pair from outside is going to be a retinol or retin-A product when treating sun damage. This is going to help keep that skin turned over and help even more with product absorption. And as we already know, we usually discontinue use of retinol or Retin-A 1 week, 5 days maybe if they're very oily or acne prone and dependent on that retinol. But stop that prior, and then same distance, stop it for about 5 days to a week after your microneedling. But definitely add in that Retin-A or retinol. If you prefer a glycolic or alpha hydroxy acid product, that's fine as well. Hopefully this video has been informative. I hope you guys have a great week. Wear your sunscreen. Bye.